Phlebotomy laboratory services across the HSE are a vital component of hospital diagnostic and patient care infrastructure. These services include the collection, handling and processing of blood specimens for medical testing in a hospital laboratory environment. Phlebotomists, trained healthcare professionals, are responsible for collecting blood from patients using safe and standardised techniques, ensuring both patient comfort and the integrity of the sample. MedLIS supports the collection and processing of blood samples across HSE hospitals and other healthcare settings, providing a seamless experience for the patient, healthcare professionals and laboratory staff. In a hospital setting, phlebotomy services support nearly every department, from emergency care and surgery to oncology and clinical medicine. Accurate blood collection is essential for diagnosing a wide range of conditions, monitoring treatment effectiveness and guiding clinical decisions. Using MedLIS, phlebotomy teams work closely with laboratory, nursing and clinical staff to deliver timely and reliable results, which are crucial for patient outcomes across the HSE. Phlebotomy order communications is the process of transmitting, receiving and documenting orders for the collection of patient blood samples involving HSE phlebotomists, nursing, laboratory and clinical staff. Phlebotomists collect blood samples from a patient using a MedLIS integrated electronic solution, a personal digital assistant, patient wristband with barcode and a handheld printer. This approach provides seamless order communications for the patient and healthcare professionals across HSE hospitals.
One of the aims of MedLIS is to facilitate electronic requesting of all laboratory tests at source, as well as electronically recording collection of those samples at source. As part of one national laboratory record per patient, clinicians should have access to all results on that patient, regardless of where that sample was processed. As the Order Comms lead for the project, I'm passionate about rolling out this Order Comms solution throughout the 43 hospital sites. Order Comms will be a game changer both for our laboratory colleagues as well as our clinical colleagues in the hospitals.
So I work in Beaumont Hospital and we introduced MedLIS last August. So we've had it operational for 10 months. It's a very busy department. We see perhaps about 1,000 patients a day through phlebotomy. And when we introduced MedLIS last August, we had bridge system used on the ward, which meant when the phlebotomist went to the patient's bedside, they asked the patient their name and date of birth and they scanned the patient's wristband. They use a PDA to check the orders that have been placed, and then they print the labels off first. They take the orders, and then when the orders have been taken, they put the labels onto the blood bottles and then they scan them again to say that they've been collected. So this gives great traceability for the wards to be able to tell what time the blood was taken at, who took it, and exactly what samples were taken. So from that perspective, it's a fantastic traceability for everybody involved. The ward system has gone very, very well. Phlebotomists like using it. It's great for patient confirmation, whereas previously, we didn't have to scan. We just asked the patients their name and date of birth and check their armband. But this means that bloods cannot be taken without an armband. So there's absolute confirmation of the patient's identity, which is critical for safe blood sampling. The training is absolutely crucial to the seamless running of the system, because if the doctor doesn't place the order correctly, then that can lead to issues, whereas we want to make sure that every blood is done correctly on the patient. And when the training has taken place and they have been trained correctly and they use the system correctly, there is no issues with it. They are absolutely guaranteed that we have the right patient, right sample, right time.